we'll go ahead and start with you to kind of give us a update of where we are with some local COVID numbers.
Yeah, good to be with you as always, Debbie, and appreciate the chamber and the opportunity to do these, and hopefully they're helpful to our members. I'm going to have a short update today because really the numbers look pretty good. We sort of we dropped after January. And we sort of been down to about anywhere between 10 and 15% of our population here at the hospital are COVID patients, and that really hasn't changed much since February. And so that's really good. It speaks to the vaccine rollout. It speaks to people protecting themselves and taking the virus seriously. And so really, we do expect some uptick in the summer, but that'll depend on how many people go ahead and choose to get the vaccine. And I know Norris is going to talk about this. I just can't emphasize enough the importance of the vaccine. It works. It's kept people out of the hospital. It's keeping people out of the hospital. And the risk reward with the vaccine versus the illness of COVID is very straightforward and easy to see that the vaccine makes a huge difference. And so I encourage everyone to get vaccinated that's eligible. I would, any member of my family I've told to get vaccinated. When my kids are available to get vaccinated, I'll do that. It's so effective against preventing COVID. And so that's really what's going to be the difference for us here. And I think if we continue to see adoption with the vaccine and people continue to be smart and careful, or actually do see an end to some of the major lifestyle changes that we've had to make over the last year here in the next several months. So I hope I didn't say anything that you disagree with, Dr. Little, but with that, I'll pass it to you.
No, thanks, David. No, hello, everyone. Certainly agree with that. We've reached a steady state in terms of the number of COVID patients we have in the hospital, and it's certainly good that the numbers are decreased from the really high numbers that were around in January, but really the fact is that people are still getting COVID and still getting severe COVID, and people are still dying from COVID. So I want to emphasize that this is still an illness that can be high risk for people, and the predominant COVID out there right now is probably one of the variants, likely the UK variant, maybe some of the others and these are more contagious, and some of them are cause more severe illness even in younger people, and that certainly is the experience in Brazil, and certainly the very, very terrible things that are currently happening in India right now. Very unfortunate. So want to emphasize the recommendation around vaccination, and I would share a few things about that. Number one is that the vaccinations that we currently have are effective in preventing severe disease with the variants. So I think there's good evidence that even with the variants that we currently have, if you get vaccinated, it is protective. And there was, I think we had this had just come out at our last informational session a couple of weeks ago around the Johnson & Johnson vaccine and the blood clots that occurred. And I just want to talk about that. It's extremely rare, probably something like 1.5 million people may get that condition. And your risk of having, severe COVID is significantly higher than that. So I certainly think it's a reasonable vaccine. It's easier because it's a one-dose vaccination as opposed to the Pfizer and Moderna. So we certainly recommend that. as well as the Pfizer and Moderna vaccines. There is, I think there's currently a request with the FDA for Pfizer to be able to offer vaccination to younger people and even children, and I think that's pending. And there's some likelihood that the Pfizer vaccine will get formal FDA approval probably midsummer. I think that'll be a help too. It would no longer be just an emergency use authorization, but it would actually be a fully approved, FDA approved vaccination. The other thing I wanted to share with you about COVID is in relationship to people that have mild COVID. There's some recent data that has come out looking at populations of people who had COVID but were not hospitalized. So they didn't have moderate COVID, didn't have severe COVID, they had mild COVID or even asymptomatic disease. And somewhere between 60 and 70% of those individuals are diagnosed with an additional illness within 6 months after having had COVID. And that's concerning because there is evidence that COVID may affect people's long-term health, even if they have only mild disease. And I think that's another reason for the people that think they're at lower risk for severe COVID to consider vaccination, because even if you have mild disease, it may have some negative repercussions in terms of your health, and the vaccines would help prevent that. Just want to reiterate, just with the Pfizer and Moderna, the messenger RNA vaccines, just that these vaccines don't cause any genetic changes. They're kind of a one and done. The messenger RNA goes in, kind of gets you to produce the spike protein, which occurs. Your body creates an immune response to that, and then all that material goes away. Your body disposes of it, and there's no effect on your cells or your DNA or any other genetic changes that can occur with these vaccines. So our experience at Piedmont is that these are very safe. We have not seen severe reactions other than just the mild, next day, sometimes kind of flu-like symptoms that last for a day. But other than that, the reactions have been pretty mild and no severe illnesses or problems. We have not seen any adverse effects related to the Johnson & Johnson vaccine in our experience. So again, we want to be a resource if you have questions, or if you have staff or employees that have questions around this. We'd certainly be willing to speak to that, and encourage that this is really the opportunity that we have to move back to not wearing masks and not social distancing and not doing all those things that everyone is very weary of over the last almost year and a half since we've been dealing with this. So any questions that I can answer around that?
Thank you for that information. I know as we hear these updates every other week, it's good to hear that our numbers are going down. And just in talk around town, I know people that have watched these and listened to both of you, and from what you have said, have encouraged them to feel safe in taking the vaccine. So I personally want to thank you guys and your team for that. Real quick, either of you can answer this. Are you still working with businesses to do some mobile vaccine clinics, or can we still say people can reach out to us here at the chamber to get that scheduled?
Yeah, most definitely, Debbie. Our mobile vaccine clinics have been very well attended and successful. And it's been really our privilege to partner with local businesses here that who have employees that want to get vaccinated. So if you haven't done that and would like to, reach out to the chamber. And there's a couple of different options we can offer, whether it be a mobile vaccine clinic or even a scheduled on-site here visit, depending on how many employees you have and how many vaccines you need to give. We'll work with you to see what makes sense. But absolutely, if you want sort of a customized vaccine program based on the convenience for you and your employees, we're happy to talk about that and get in touch with the chamber and Debbie's team to get in dialogue with us about that.
Yes, and we'll include that contact to us in the comments of this video so that we can connect them with your team for access to that. So again, thank you both for your time and your dedication to the health of our community. And we will see you on here in a couple of weeks.
Have a great day.
Thank
you.